Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back for our last episode, episode 3. Let's continue the conversation by talking about providing support to healthcare workers. I hear a lot of what we can do for our communities and what we can do for our patients, right? And in just the broader world. But I'm wondering then, so I sit here and I'm wondering, what are we doing about our own selves? And I'm thinking about what you mentioned earlier in our conversation about how your experience changed after becoming a mother, and I think about that, there is a very real impact on all of our healthcare workers who have patients or taking care of patients or witnessing this type of violence. And what does that then mean for us? Who's taking care of us? Where's the committee for us after all of this, after this terrible week you've had, this terrible month, this terrible year of all this? What about us?
Yeah, I think that this is such an interesting issue and is actually something that really goes unaddressed. I think that we've seen more, healthcare worker burnout in the last few years, and particularly with the COVID pandemic, this became the forefront of everything. And this is something that we're not there yet. I mean, we are still seeing a tremendous amount of healthcare worker burnout, and some of that is, I think, what is burnout? We work very hard. It's long hours. Mm-hmm. It's physically demanding. We are, it's emotionally draining to be available to patients and their families all the time in the way that we need to be. And we've recognized that by giving people tools for things like mindfulness and support systems through the hospital, and, destigmatizing mental health and saying, it's okay to talk to somebody if you need to. These are all things that have been positive changes, but my feeling is that we're still not there yet, that we still need to be better about supporting one another and supporting our colleagues within the healthcare system. And I think we also need to really have a conversation about the difference between burnout and moral injury, which is, burnout has to do with stress and work and all of those kinds of things. But moral injury is really, I think what comes when you're seeing a problem over and over and over again, and that there are answers to it, and you can't stop it. And that is where people really, really struggle with. I'm seeing children, I'm seeing, people in my emergency room every day who are shot. It's just pain after pain after pain. And I know that there's solutions to this, but we just can't seem to implement them, or people don't care enough to implement them. And that's where I think healthcare workers really need to look out for one another, is when it becomes less about like, hey, I just need some time off. I need to collect myself. I need to be more mindful and use these tools that I have to prevent burnout, versus the conversation that is very different when it starts to feel hopeless. And those are the colleagues that we really need to be looking out for right now, because those are the ones who are either going to leave the profession, which is incredible losses, or those who are at risk of, hurting themselves. And so I think that that's something we really, really need to focus on. And we're not doing the job that we need to do for that right now. We can all do it in our own spaces, check in with the people that you work with.
Yeah, I think I'm really glad that you brought up the two things, burnout and moral injury, really is what that feels like. And that's very different things. And you're totally right. And I think, I bring this up because with the pandemic that's happened, we kind of heard all these key terms and these big words like be resilient and push forward and self-care and all of these things. And I have to tell you, honestly, as an RN, I was wildly annoyed with it. Yeah. Wildly annoyed, because I don't need you to tell me to be resilient. my resiliency isn't the issue. The pizza party doesn't make me feel better at the end of this, this
there's no
shift.
amount of yoga that's going to make me feel better about an ICU full of COVID patients.
Absolutely not. I don't care how much massaging that you're giving my shoulders. I don't feel better, right? There's a bigger issue happening. So I'm really glad that you brought those two things, out. And so that's an important piece, because we are witnessing a lot of violence, and we're just witnessing a lot of, working conditions that don't feel good and can really, really have profound effects on our own, our own psyche in that way. Now, I'm just curious if you could speak a little bit. You gave us a lot of information, really good information. I'm curious if you could speak a little bit about maybe giving us a scenario, giving our listeners, our nurses, our farms, our physicians, anyone who's listening in, just giving them a scenario of where a team like this, where a multidisciplinary approach like this working towards firearm violence has really been a success, or has started to be a success and played out, and maybe give us some ideas on how we can carry that same thing back to where we are.
I think that there are several good examples around the country where we've had really good multidisciplinary programming. I think that so there's several. So if we take urban violence, for example, and look at the urban violence issues that contribute to gun violence, then we might be thinking about things like cure violence programs, hospital-based intervention programs, community-based programs, and enforcement-based programs. And I think, there's a lot of places where one of those programs exists, but it's really having all of them working together, and then bathing all of that in the sort of bath of economic investment in community that has really become successful. I think we've seen a little bit of that maybe in Oakland. A little has had a pretty good success, and there's some other cities that have seemed to really figure this out. But it's really hard. I think on a more micro level, looking at like hospitals, for example, that have invested in community health workers, have invested in violence intervention programs, have invested in primary care and mental health, and have really invested in the success of their community partnerships. So the one that really comes to mind is there's been a lot of investment in Boston around housing and community investment from the medical centers, where the medical centers themselves are, partners in housing, equitable housing projects, buildings and apartments really close to the medical center that help the patients and help the community, but also investing in local businesses to do the work of building this housing, and how much housing is integrated into this. And so that's another really good example. And then, just in individual groups and individual practices, you have groups of people who are like-minded, who have interests, who put on, community programming. There's, getting out into the community, doing safe storage demonstrations, talking to families, going out to the schools. A doctor and a nurse in a school is a tremendously powerful tool to talk to teachers and principals about being safe. And so that's, I think, what some of these multidisciplinary and interprofessional partnerships can look like from the scale of an entire city down to the scale of an individual practice.
Yeah, that's excellent. That's excellent. Dr. Vani, you have given us a ton of great information. It really has been really great talking to you about this. And, honestly, I hope that people are really feeling maybe empowered is the word, to say, you know what, we got to do something, right? We got to do something about this. And that we all have the individual power where we are, whether you are a physician, a nurse, a pharmacist, a medical assistant, union secretary, it doesn't matter, to really stand up and say, like, this is a problem. And you're right, we need to tell the whole story. And more importantly, we're a part of this. We're a part of this, and we can be a part of the solution for that. So I appreciate you really, really, uplifting that. And is there anything that we haven't covered that you'd like to leave our audience with?
No, I don't want anyone to feel overwhelmed or like this is not something that we can address. I think that sometimes I look at those numbers that we talked about, the 40,000, and think, how are we ever going to move the needle on this? But if everybody comes together, if everybody takes their one piece of it, then there really are very viable solutions, and we can make this happen. But it's about compromise. It's about working together. It's about listening. And it's about really thinking about what the root causes of these problems are in a very real way, instead of being reactionary when something happens, and not letting up. We tend to have a whole bunch of stuff that comes up every once in a while when there's a big event that draws a lot of attention. But we really need to recognize that this is a problem that affects people every single day. And so we need to be working on it every single day.
Yes. Thank you so much, Dr. Bonnie. I appreciate you taking the time, and I appreciate the work that you're doing. Quite honestly, you're doing really big, important work, and I appreciate that. So thank you for your time, and thank you for this knowledge. And I hope everybody enjoyed listening to this conversation today.
Yep. Thanks for having me.
Thank you all for joining this podcast. We can really make a difference by supporting our fellow healthcare workers and colleagues, and by getting involved in our communities. One step at a time, one intervention at a time, one even small little thing at a time can make a difference in the prevention of firearm injury and for decreasing violence within our neighborhoods, our communities, our hospitals, just generally where we live. Let's support those doing this work and see how we can get involved in helping make a positive difference.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.